Hello everyone, I hope that you are doing fine. Today I would like to talk a bit about the undervalued part of motivation for therapy. I have chosen this topic because this is a subject that has frequently became an important part of my reflections and thoughts, especially when I try to understand and evaluate if my clients are really motivated enough and prepared to embark on therapy journey or not. The word motivation has a Greek origin, which means to move forward or something which moves. In a context of psychotherapy, it is very common, arguably essential, to evaluate the context to which the person is really motivated or so-called driven to participate actively in his or her therapy process. It is about having a driving force that pushes us forward and initiates actions and hold and strengthen purposeful actions and behaviors in us. Generally speaking, we might, relate to a straightforward and, shallow level on the concept of motivation when we think about the word motivation in general. For example, we believe that we have to have, cognitive desires and wills, maybe, adequate level of dopamine in our brain in order to be able to accomplish a task and or an educational program, or to quit something or establish a new habit, and so on. But in therapy context, I believe that the picture can be a little more nuanced or a deeper one. There are people who have got an external source of motivation for therapy. For example, they are perhaps referred by other professionals for therapy, or they have been told by general practitioners that they should go to a psychologist or psychotherapist because their problems seem to be related to their mental health, to their mental well-being. In contrast, I have also met many people who have got an internal motivation base or drive, which leads them forward and has consciously and unconsciously encouraged them to seek help, something that comes from them to understand themselves better. We know by experience that we can learn much better when we are driven by inner motivation and our true willingness, compared to the time when we are pushed by other people to do something. And when we really want to do something, we just want to succeed and unconsciously put ourselves in a path of learning and earning something new or better. However, it does not necessarily mean that if we feel that we really want to achieve or get something or feel motivated, we are always in a very right place to start and tolerate therapy process. Because as mentioned before, therapy in a deeper level is about driving into an unknown ocean of emotions and processes, which can be very tough and overwhelming. Many people who appear to be positive and willing to give a try to therapy might not necessarily be totally prepared for that. This is my experience, at least. Regarding the concept of motivation, I think that there should be a tiny extra element on the top of it which fuels the inner drive and energy, something that has illuminated and come up in our reflections and body through time. I assume that there must be a threshold at which you start to experience something important in your body telling you that it is the time to start a change process, and that you cannot go ahead like this. This is the time to make that change which you deserve and have always needed, but you did not dare to think about or start that change. until you reach out this point, or as I call it, motivation threshold, you might cognitively think and know that you are motivated and that you have to do something to change your life situation, without knowing that there is something very important missing, which has to come to place and be present first to drive you forward and, push you through that long-awaited transformational change. I can share an example from my practice here with you. I am engaged in therapy works for many clients with trauma-related disorders in my clinical practice. I have repeatedly met people who suffer from trauma reactions and big psychological symptoms. Many of them really report motivation and willingness to start therapy, and some of them are afraid of feeling rejected and not, receiving the treatment, the therapy they really deserve. And, this fear to not to receive that needed treatment occupies a big place in their reflections and among their feelings all the time. Sometimes it feels like, they just want to prove that they really deserve a treatment here and now and as soon as possible, and that they have got a very difficult life that they can barely tolerate to live, and then they appear to try desperately to get that help they think they need now. And I understand it, because there is a pain which accompanies trauma, a pain which is not only in the body, but it is also in our soul. But I have several times experienced that when we start the process and then it arrives the time of the stage of facing all those buried feelings and emotions, it seems that, they are not there as they should be. They experience that it is so difficult to let these feelings come up and to express and really experience them in their bodies. Some of them appear to become, at some point emotionally absent or defensive in the process, and try to compensate for this absence and distance by intellectualization or going around, the process by going through and using a lot of thoughts and reflections all the time. But all in all, there will be little focus on body and instead a lot of focus on thoughts and defenses. And then I start wondering, where is that motivation part which they talked about prior to the course of treatment, before we started the first session? How come has this motivation vanished so quickly and cannot, serve more energy and bright into this healing process? Some of them admit that they are experiencing again that feeling of having no purpose and motivation, unfortunately, and they struggle, finding a meaning, make the process of treatment meaningful and exciting. And so it's better to quit the process because it does not move forward. And all of this creates a feeling of, re-experiencing a life of its old pattern, or to some extent, a re-traumatizing process. It will be a re-traumatizing process for them. So this can happen also due to the fact that many of us have not really understood or been, given enough knowledge about therapy process and how it works. As I mentioned previously, you are going to do the job of therapy and not your therapist. It will not be, holistic and enough to be only cognitively motivated and persuaded to require, a change in life. But you should also feel the power and willingness of that underrated part of motivation and desire to move forward in your body through a deep sense of pain, which is followed by an insight and understanding, which drives you to take an action. So when you really reach out this threshold, then the body will be on board through the process, because then your body, does not feel obligated to protect you from your own feelings. When you are in the middle of the treatment and through the process phases, then it's important to have connection with this part. Then you will experience, ups and downs of emotional movements and experiences which are authentic and in accordance with your true self emotional needs. I remember that I really was, moved by the words of my client when she said that this is the first time she is experiencing the feelings of empathy and love toward herself without, feeling guilt and shame about that. And that she is so grateful for being, for having this opportunity to come into this point of self-disclosure and trusting herself and own needs and inner whispers of care and love. I gave her feedback and said that she should be grateful, of herself actually, because she had been going through this, enormous process long before this moment of breakthrough here and now. This is she with her real motivation and inner pain who could really do this, and I'm just witnessing this wonderful act of self-love now. She confessed that she always felt that she had to build, walls around her soul and heart, and was, at some point convinced that she cannot show others who she really is, because it meant, showing her feelings and emotional needs, and to taking a little place among others and in relationships, and also getting very clear about her boundaries in relationships. And then she always felt that no, this will be too much for her. But since she really did realize that going through this path of self-suppression will lead to destruction and, dangerous outcomes, she came into contact with a deep grief and sadness, and felt that she has missed a lot of her life so far, that she really does not want any more to continue like this. When I met her in our first evaluation session, her way of talking, the way she formulated her words and thoughts and reflections around motivation, and timing for a true change in her life, gave me an impression and a gut feeling that she is ready. She is the one who reached that important motivation threshold. It was not difficult to see that she did a lot, to adjust her life already before our first session in order to really knock that defense wall down and to make it dawn, accomplish the process. She, for example, I remember that she said that she talked with her manager about a period of sick leave, because she's going to need time for self-construction and therapy, or that she asked her sister to move her in her place for helping her with the kids. So she really gave a picture of a dedicated person who had felt, enough is enough. I should do something with my life. And the most important thing to note was that she presented, a narrative which consisted of a lot of pain and sufferings over time. But in the recent time, she decided to pause, reflect. In other words, she really went through her pain. She embraced it and found a way to make advantage of her helplessness and grief, and then try to transcend these feelings into the path of motivation for change. She was a true candidate for a therapy process. That was my evaluation. And interestingly, her efforts paid off much earlier than what I generally experience in clinical practice for those of a complex trauma disorder. I believe that such a good result is mostly due to that tiny and undervalued but tremendously important, boosting part of her inner motivation. So it really pays off to start, reflecting about your goals and ambitions about therapy, and also to see to which extent you are truly prepared to meet yourself and your wounds, those deep scars and hidden traumas? These questions can be a start point for you. You may ask yourself which movements and changes, which constructive actions you wish in your life. Do you have a superior, big goal and also some sub or smaller goals under that? It is important, by the way, to be, very concrete when answering these questions. And also you may ask yourself how you can discover and acknowledge the small steps which you take, because this is also a vital thing to do. Therapy will be a resilient and moving process with many ups and downs, and therefore it is important to be equipped with some concrete self-knowledge insight about your own expectations, your own purposes, strengths, vulnerabilities, abilities, and goals. I would like also to encourage you ponder and weigh in your mind what really you need to make that happen, to reach that level of willingness and motivation. The good news, the fact is that as trauma has the power to influence and tighten our mind and biology and soul, healing has also the potential and power to create new spaces and bring safety back to our body and nervous system and soul. But to transcend these shifts, we need a certain level of inner power and motivation and insight. So I hope that these shared thoughts and words will be able to, make some stimulation and new insights for you and the way you think around the concept of motivation and therapy. So thank you again for joining me. Please keep in touch and share this video with someone who you think may find this one as interesting. Take care. We'll connect in another video soon, hopefully. Bye.